I had 4 lower back surgeries. My last one was in 2006, and it worked for a little while, but probably within a year, I was pretty much right back in the same boat that I was in before. Weakness in legs, lots of pain, back in the same gamut. I've had doctors, stick me in pain management. I had a horrible experience there. I just didn't, from the get-go, I wasn't comfortable with that setting. And I know just experiences I had even sitting in the waiting room and then questioning doctors, asking them, about different procedures that I'd researched that had come out, different things that like an institute I'd looked at, all from here, just anything. I'd had some physicians that wanted to put in morphine pumps and nerve stimulators, and I had just, every time it seems like I would ask them about something else, I would just get shoved to the side or just basically told to sit down, just to sit and, take this, take that, and just, that was as good as it's going to get. Of course, you never stop searching, and I guess I'm thankful that I like to research and try to find answers to things, because a lot of that was just unacceptable, because I have always enjoyed being very active. Love, softball. I love dance, motorcycle. I used to ride a motorcycle, ride horses, all those types of things, and I've not had a lot of experiences like that since I've been dealing with a lot of my back. It just seems like it robs you. And then like sometimes when you get kicked in this system that physicians or different places that you go want you to see a psychiatrist, and they start to make you doubt yourself sometimes, that their pain is in your head, and that can be a real struggle. I was struggling. Actually, I had spent the past year visiting different physicians, trying to get different opinions. When my neck and my lower back started giving me problems again, and I had my last neck surgery was in 2011. I had one in 2009, one in December of 2010, and one in January of 2011. The one in December failed, so they went right back in to fix something else. The symptoms never cleared up. I went for a second opinion, actually. One of my experiences that just left me so cynical, I went for a second opinion before I went for my final opinion with my neurosurgeon. And they told me one thing, and when I went back for a visit with the neurosurgeon that had done a lot of surgeries on me, he told me everything was fine. I was healed. He didn't see a reason why I felt the way that I did, and all of those things, which it took all I had to keep everything together and to make it to the car. And of course, that's where I had my cry, call your friends. I can't believe this is happening, or whatever. And so then you spend the next year second opinions and third opinions and fourth opinions, trying just to seek help or whatever. And a friend of mine, actually, from my hometown, which is it's about 4 hours from here, had called me one day going, a friend of ours, a mutual friend of ours, is actually coming to Nashville to see Dr. McCord. And they have a completely different MRI. They have, some different procedures. And I think you need to call them. And so I did. And that's when I met with Dr. McCord and went through the oddest MRI that I'd ever seen, but actually it's turned out to be very well worth it. I met with him, and he looked everything over and, said, yeah, we can fix this. No wonder you feel like you do. Here's why, and just, showed me here, told me exactly what was wrong, and so we fixed it. And right now I'm 6 weeks out. I walked up some stairs to get into the doctor's office where before surgery, if I squatted down at all, I could not get back up. Like if I bent down to get something at Walmart, I really had to watch that. Somebody had to be with me, to help me back up, or it was going to be a bad situation that day. So anyway, I went upstairs today, and I've been over to get something in my kitchen last night, and came back up, and I'm doing really well so far. I'm very pleased, and As a matter of fact, here in a few weeks, he's going to go back in and straighten my neck out as well. So I've had a wonderful, positive experience here. And I guess I just have to say thank you for respect and not blaming a patient for being sick. So many times I think maybe what I feel like I've run up against before, that maybe a physician might have been unsure how to approach it or how to help you, and then instead of saying that they just can't help you, they blame you. And so I've never experienced that here. It was just a whole different atmosphere. He was very upfront with me about, what he felt he could do, what he couldn't do, and I've so appreciated that, and what expectations to have, and I've appreciated that. I guess I just, it's just nice to have somebody that listens, and that would at least tell you there isn't. I mean, even if there wasn't something they could do, that would at least point blank say to you, I can't. Let's see. One activity I really enjoy, I had just taken up or tried to take up as much as I could this past couple of years, was belly dance. And so, let's see, I'm 6 weeks out right now, and I saw him this Monday. Today's Friday, I guess, or whatever. And Tuesday, I had an attempt at, a drill to do for belly dance. You have certain drills and things that you learn or whatever. And so it was a sad little attempt, but at least it was an attempt. It was a start. It was really great. And I remember how much sadness I felt, just a few months ago when I left class one night, and I left early because we were doing a dance, and you had like balance on one leg and balance on the other, and my leg just wouldn't support me, and I just left. I got my stuff, and I left, and I came home, and I was very sad. So I'm looking forward to picking that back up. And even with the surgery, he went in through the front, and then a couple of days later, he went in through the back, and I have bone grafts from both sides, which I guess I was very fortunate in that fact that he didn't have to chip or break bone. He could take the bone marrow, which was actually, it wasn't anything like I thought it was going to be. I expected it to be far more painful than what it was. Not that it wasn't painful. I mean, you had things it was tough, but it was way livable. It was very manageable. But I never thought twice about even scars or anything. And, as far as like, belly dance costumes or swimsuits or, anything like that. It's just, he's just given me my life back. I know he's got to hear that a lot. I'm sure he does. I'm glad that he's different, and I'm glad that there are people out there that aren't afraid to take a different approach to things. And different isn't always a negative thing. Different is very, very good sometimes, because without innovative people, we wouldn't sometimes have the ability to move forward. And so I think Dr. McCord's got to have one of the greatest jobs, because I'm sure he hears every day, thank you. So I just think that would be a really cool feeling to know he makes such a difference in people's lives every day. So.